is Marie. I'm an FMP student, and I'll be doing your musculoskeletal assessment today.
Okay.
Okay? First, we're going to go ahead and start with your hands. We're just going to inspect your hands. So we're just checking for any deformity, any swelling, your nodules, joint symmetry, and so far they look good. Next, we're just going to go ahead and do active range of motion for your hands. So for your hands, go ahead and flex your hand 90 degrees and then down, and then just abduct it away from you, and then adduct it, and then make a fist. Okay, and I'm just gonna palpate your tibial, proximal, and metacarpophalangeal for any tenderness and any pain. Any tenderness?
No.
Okay, next we're gonna go ahead and move to your wrist. Just gonna inspect your wrist again for any deformity, if it's your joints are symmetrical, any muscular atrophy, and your nodules, and so far they look good. Next, we're gonna go ahead and do your active range of motion for your wrist. So go ahead and bend your wrist upward 90 degrees, and then downwards, and then go ahead and adduct it. Okay, and just gonna palpate your wrist here for the metacarpal, carporadial, carpo-ulnar for any swelling, any tenderness, and so far I don't feel anything, any pain.
No.
And then there's two tests that gets done, a specialty test for your hands and wrists, which is called a tenial. So for the tenial, just go ahead and turn your palm upward, and I'm just gonna palpate on that median nerve right here, and if you feel any pain, up to your elbow, and then down to your fingers.
No.
Nope. Any pain?
No.
Okay, so that would be a positive sign if you felt pain. Nothing?
No.
Okay, and then we're gonna do the phalanx test. So for the phalanx test, go ahead and turn your hand 90 degrees. And just for a few seconds, if you feel any pain, 40 to 60 seconds, that would be a positive test. Do you feel any pain right now when you do that?
No.
Okay, perfect. Next, we're going to go ahead and go to your elbows. We're just going to do the range of motion for your elbows. We're just going to extend it and flex it and supinate it and pronate it. So for your elbows, just go ahead and extend it and then flex it backwards. Any pain?
No.
And then forward again, and then just turn it, supinate it, and then pronate it. Perfect. Any pain there?
No.
And then we're just gonna palpate the ulna, and then the olecranial process here, and the lateral and medial epicondyles for any swelling, any pain, and so far they both look really good. And then next we're gonna go ahead and go to your shoulders. Same thing, we're just gonna inspect first your shoulders, if there's any swelling, any deformity, your nodules, your joints are symmetrical, and so far they're both symmetrical. Next, we're gonna go ahead and for your shoulders, we're gonna go ahead and do your active range of motion for your shoulders. So first, for your shoulders, we're gonna do abduction and adduction for your shoulders. So for the abduction, just go ahead and extend your arms again, and then extend it backwards. And then we're going to do an internal rotation, so it's like you're scratching your neck, and then do it with your other arm, and then we're going to do the external rotation, so it's like you're reaching for your scapula. Perfect. And then other arm again. Okay, any pain on that?
No.
And then for your shoulders, we're just going to go ahead and palpate your AC joint here, your coracoid process, your subdeltal bursa here, for any swelling, any tenderness, and so far they look good. So a specialty test that gets done for your shoulders is the Hawkins test. So So you're just gonna extend your arm here. Just relax it here. Relax it on my arm. I'm just gonna push it down. Do you feel any pain? A positive test if you feel pain there.
No.
Okay, same thing in the other arm. So just relax. Just gonna turn it, push it down. Any pain?
No.
Okay, so that's called a Hawkins test for your shoulder. That would be a positive test that they would do if to check for any further abnormalities there for your shoulder. Okay. Next, we're gonna go ahead and go to your head and neck. So for your head and neck, same thing. We're just gonna inspect if it's symmetrical, any deformities, and so far it's symmetrical. So first, you're gonna go ahead and touch your chin to your chest. Okay, any pain?
No.
Okay, you're able to do it, and then touch your chin to your shoulders, both on each side. Okay, perfect. And then laterally also. Any pain?
No.
So far that looks good. We're just gonna check your temporomandibular joint. So I'm just gonna ask you to open and close your mouth. Just listening for any clicks, any pain.
No.
Nothing. Okay, and then we're just gonna go ahead and palpate your sternoclavicular, your substernal, your cervical spine, your trapezius muscles, and your temporomandibular joint.
Okay.
And so far, I don't feel any tenderness. And then a specialty test for your head and neck would be the Spurring's test or the vertex compression test. So you're gonna go ahead and just extend your neck back and then turn laterally. And you're just gonna put pressure. And if you feel pain, that would be a positive test.
No.
Okay, perfect. So that's your head and neck. Next, we're just gonna go ahead and go to your knees. So for your knees, just checking for alignment. They're both aligned. Looking for any bulging. And I'm gonna palpate the suprapatellar pouch, the size of the patella, the tibia femoral joint. So far I'm palpating and I don't feel any swelling. Do you have any pain when I do this?
No.
Okay. Next we're gonna go to the range of motion for your knees. So go ahead and just go ahead and lay down. Face this way. So for your knees, you're just gonna extend your knees straight out. And then you're going to flex your knees to about 120 degrees. Okay. And also the other one. Any pain there?
No.
And then we're going to go ahead and check your vagus truss, which is abducting the lower leg. So I'm just going to hold your femur here and your ankle here. And we're just going to abduct, which is away, and then we're gonna do the vagus stress test, which is gonna be the adducting part. Okay. Any pain?
No.
We do this. Okay, perfect. And then next, a specialty test for your knees is called the Lachman test. The Lachman test. So for this, we're just gonna push against the tibia to assess anterior and posterior for any ligaments, any pain, okay? So I'm just gonna hold here, I'm just gonna pull. Do you have any pain?
No.
And then we're gonna do a Jor's test, okay? So I'm just gonna flex your knee here, and I'm gonna go ahead and sit on your feet. And then where your popliteal here, so I'm just gonna go ahead and pull your muscle. Any pain?
No.
Okay, same thing with the other feet. Any pain?
No.
Okay, so that's the Jor's test. And then we're gonna do another test, which is the McMurray's test. So I'm just gonna bend your knee, and I'm gonna push while I extend it, okay? Any pain?
No.
Same thing here. Just rotating it at different angles. Okay, so far it looks good, okay? So that's the McMurray's test. So those are the 3 specialty tests that will get done on your knees, okay? Next, we're just gonna go ahead and check your feet. We're just gonna inspect it for any swelling. We're just gonna inspect your feet for any swelling, any deformities, just checking the nodules, the joints, if it's symmetrical, if you're flat-footed, which you're not. So just checking that. So far looks good. So for your feet, we're also gonna do the range of motion. So go ahead and flex your toes. Okay, go ahead and curl your toes. And then we're gonna do a lateral movement, which is the eversion, and the medial movement, which is the inversion. So just gonna do circles with your feet. Okay, perfect. You're doing it really good. And then we're going to do a plantar flexion. So you're going to bring your feet as far away from you. So you're just going to bend this way. And then we're going to do that's the plantar flexion. And then we're going to do the inversion, which is you're going to bring the soles close to each other of your feet. There you go. And then we'll go ahead and do the eversion, which is you're going to bring the soles away. Okay, perfect. Next, we're going to go ahead and palpate the interdigital and the distal interphalangeal and the proximal and the metatarsophalangeal of your feet. We're just going to palpate for any tenderness, any pain, and so far, do you feel anything?
No.
Okay, perfect. And then we're going to go ahead and go to your ankles. We're going to inspect for any swelling, any deformity. We're going to check the Achilles. And so far, they both look good. No swelling, no redness. And then we're going to do your passive range of motion for your ankle. So we're going to dorsiflex the ankle and plantar flex the ankle. Can you go ahead and do that? Your ankle. Perfect. Other side too. Okay, looks good. So that's your ankles. And then now we're going to go ahead and move to your hips. So for the hips part, you're just going to stay supine like this. And then we're going to assess your passive range of motion. So we're just going to rotate each extended leg externally, internally, and then return it to original position. So with each leg extended, we're just gonna rotate. Any pain?
No.
And then we're just gonna go ahead and do, we're gonna flex the knee to 45 degrees externally, internally. Can you do that? Perfect. Other one? Okay. And then we're gonna go ahead and do abduction and adduction of the hip. So abduction is away from your body. So go ahead. Okay, other leg also. Okay. And then go ahead and cross over. And then the other leg also. Okay, any pain when you do that?
None.
Okay, looks good. And a specialty test that gets done for your hips is called the Thomas test. So in a supine position, we're just going to bring the knee as far back to your chest, and the positive test is when the extended leg lifts off the bed, okay? So we'll go ahead and start with your right side. So we're just gonna go ahead and bend as far as you can. So we're just checking if this leg lifts up, which it doesn't, which is good. So same thing on the other side. We're just checking if this leg lifts up when you do that. Okay, looks good. And then the other specialty test is called the Patrick's or Faber test. So what we're gonna do is we're just gonna bend your right leg and put it on top of your left leg. And I'm just gonna bend this leg. And if you feel any pain, that would be a positive test. Any pain?
No.
Okay, same thing with your other leg. Good, and bend. Just gonna bend, push down.
No.
Any pain?
No.
Okay. So that's the specialty test that gets done for your hips. And then next, we're gonna go ahead and go to your spine. So if you could just stand for me. And then go ahead and we'll face this way so the camera can see. So for the spine test, I'm just inspecting first for your shoulder height if it's symmetrical. I'm just gonna lift this up. So your shoulder height symmetrical. If you have any dorsokyphosis, so far you don't. If you have any iliac crest, if it's symmetrical. If you have any skin creases below your buttocks, which you don't. And then now I'm gonna ask you if you could bend slowly forward as far as you can. Okay, so slowly. Okay, just checking if it's symmetrical when you move and if it's a smooth curvature of your spine, which it is smooth, and your range of motion of how far you can bend, which is normally about 90 degrees. So it looks good. So go ahead and go back straight. And then next, we're just gonna go ahead and check how far you can bend backwards. Okay, any pain?
No.
Okay, and so far no deformity there. And then we're just gonna go ahead and assess the range of motion. So go ahead and so you were able to bend forward and backwards. Now go ahead and bend side to side, so to your left and to your right. And then go ahead and turn your shoulders right to left. Perfect. Okay, any pain when you do that?
No.
And then now we're just gonna palpate your spine again. And then we're just palpating the spinous process, the intervertebral spaces, and then we're just gonna palpate the paravertebral musculature. So for any tenderness, any swelling, so far I don't feel anything. And the last thing that we're gonna do is we're just gonna percuss the spine with the ulnar surface of my fist, okay? Okay, perfect. So that concludes our musculoskeletal